Let's talk about the best foods that can help clean out your arteries. We're talking about a problem that involves the inside of the layer of your arteries. It's called the endothelial layer. And if there's a dysfunction with this layer, you get inflammation. And you also get scar tissue, fibrosis. You also have calcium buildup and cholesterol buildup. And you can also have a clot, which is a little bit different. And one of the absolute best tests to figure out what's going on the inside of your arteries is this right over here. It's the coronary artery calcification test or scan. Get it from your doctor. It's pretty quick. It's not that expensive. It's way more valuable than a cholesterol test because it's measuring the amount of calcium buildup in your arteries, which is one of the best predictors of mortality from all deaths. So it's a really important test. It should be 0, but sometimes it could be 100, 200, 500, 700, even 1,000 or more. The key is if you find it is very high, you want to apply what I'm going to show you and then retest it every several months to make sure it's going down. All right, starting from number 1, you want to make sure that your insulin is normal. Okay, you don't want it too high. And you do that by dropping your carbs. So anything low carb would be very, very therapeutic to your arteries. So you want to do a low carb diet, ketogenic diet, and you want to do fasting. Okay, very, very important because that will lower insulin. Insulin will cause inflammation in the inside of the arteries, and the artery will become thickened, and you may even develop a clot. There'll be inflammation and something called AGE, advanced glycated end products. That's a situation that occurs where the inside of your artery, the proteins become unusable. They're damaged. And you get this from consuming too many carbs. And you can also get it from consuming like too many omega-6 oils, which I'll mention in a little bit. So this would be number 1. This is probably the absolute most important thing. You must handle this or these won't really work. Number 2, you want to consume foods high in vitamin K2, like natto, which is a fermented soybean, or liver. It could be beef liver, chicken liver, eggs, definitely the yolk, grass-fed butter, grass-fed beef, sauerkraut, maybe a little bit of hard or soft cheese that has vitamin K2. But vitamin K2 is all about keeping the calcium out of the arteries. All right, number 3, this is not a food, but it's a very powerful antioxidant. Tocotrienols is different than tocopherols. This is the vitamin E complex. Tocotrienols are 50